project manager. Jill has a rich expertise in every facet of human resources, affords her the distinction of being one of the most sought after HR professionals in the region. Creating and implementing authentic and effective HR solutions to solve an array of employee challenges have been Jill's signature for several years, with companies ranging from Sun Life Financial to BlackBerry, and also to nonprofits such as Trellis Mental Health. Now as a consultant to Waterloo's emerging business and tech community, Jill has been delivering relevant and meaningful solutions to scale, be it program level or simply getting the right advice. Jill's focus is primarily with small to medium-sized businesses who are in need of HR assistance, but may not be in a position to hire somebody full-time. Her focus is from hiring to retiring and everything in between. As a past member of the CHRPA Board of Directors, her certified human resources leader designation combined with a certificate in human resources and a business administration management diploma from Conestoga College, Jill brings a genuine level of confidence to any organization that finds itself with without some HR guidance. Outside of work, Jill is a mother of two active teenage boys. Jill is also the new member to the Family and Children's Services Board of Directors. Her range of consulting and HR outsourcing solutions include organizational design and development, employment law, employee relations, talent acquisition, compliance, employment engagement programs, among others. In her spare time, Jill has two teenage boys, Carter and Austin, who keep her busy being a hockey and basketball mom. If any one of the above scenarios is something you're dealing with, feel free to connect with Jill and she'll be happy to help you out. Our second speaker today is Amy Balatoni, human resources consultant. Amy absolutely loves working in HR. Her talent allow her to create meaningful and lasting relationships, and she is passionate about working with leaders to coach and problem solve. She understands people and the key role they play in business success. Prior to joining the H2R team, Amy was employed with a federally regulated organization for 8 years. As an experienced human resource professional, Amy understands the importance of strategically aligning with her clients to provide resources and build relationships while focusing on their priorities, challenges, and objectives as set forth by the organization. Amy's experience includes areas such as health and safety, labor relations, learning and development, disability management, onboarding and orientation, and performance and coaching. Amy graduated from Wilfrid Laurier University with the Bachelor of Communications and obtained her Human Resources Management Certificate from Conestoga College. Amy also obtained her CHRP and is a member in good standing of the Grand Valley chapter of the HRPA. So please welcome Amy and Jill to the panel today.
Good morning, everybody. Thank you for that intro, Raj. That was wonderful. So I'm going to turn things over to Amy to get the technology rocking and rolling for us. And just wanted to say good morning to everybody and Happy New Year. We're happy to be here. And we want to try and make this session as interactive as possible. I know that is sometimes difficult through the webinars, but if you actually, Melissa, are you going to step folks through how to do the Q&A, or do you want us to cover that? I guess we can cover that now. If you do have questions, please use your Q&A at the bottom of your screen. You can type in your question there, or you can also put it into the chat if you would prefer. And we'll answer any questions as we go along, or we've saved some time at the end for some Q&A as well. So we're going to cover a whole bunch of what we like to call sort of hot HR topics, boom, 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 and just kind of give you the highlights of what you might need to know and what might be on your mind right now, COVID related and also not COVID related. We'll step you through some of that as well. So feel free to jump in at any time and we'll go from there. There's also going to be some polls along the way as well. I think there's 4 or 5 different polls that will be asked of you, and you can respond, and we'll go from there. So thanks for having us.
Awesome.
So Amy and I are both with H2R Business Solutions. I'm the president of the company, and we help small to medium-sized companies with all things human resources related. So we have been busting at the seams lately, especially with all things COVID related. And we're certainly here to help. So happy to answer any questions as we go and or at the end. All right, let's get started. So the first poll question, Melissa, are you going to step us through how to do this piece of it?
Yeah, I'm going to put the poll up right now for you.
Perfect. So the question is, are you up to date with AODA legislation? And AODA is the Accessibility for Ontarians with Disabilities Act. So if you can answer the polls, you guys are on it, right on. So about half, just over half are saying yes, that you're up to date. That's awesome. For those that are not, there are some deadlines coming up for the AODA reporting, which the government will be following up with, but they have now just extended the deadline. So we'll go through that as well. So I think we're good there. So 52% are saying yes, that's good. The others we can certainly help you with if you're not up to date, and we'll share with you what some of those options are for you. Okay. Should we keep going here? Okay, perfect. So with the AODA, deadlines have been extended. So the website compliance for any of you out there who have 50 or more employees, you have to make sure that your websites are AODA compliant by June 30th of 2021. So this was originally January, but they've now extended it. So anybody who's got 50 or more employees, you have to have websites accessible. And then also, which you've probably seen before, the accessibility reports that you get, it takes about 30 seconds to complete. They just want to make sure that you're up to date in terms of all things that have to be happening for the AODA deadlines. And that has been pushed as well to June 30th of 2021. So those reports are for any employers that have between 20 and 49 employees. Okay. I'm just going to minimize that. Okay, so those that are bigger, if we have anybody on the call that does have a company that's 50 employees or more, one of our clients, Orchard Design, they're actually local there in Cambridge, Orchard Design Studio Inc. They have offered for any clients or those companies associated with us at H2R, they will actually do a free assessment of your website and provide you with a report free of charge based on what you might need to change to close some of those gaps. It's usually a cost of about $300, but they have offered to do that free of charge. So if you want to jot down Paul's email address there, he's one of the partners there at Orchard Design and is happy to help to point out what you might need to do. Okay. Next we have, the Ontario Health and Safety, the Occupational Health and Safety Act. I don't know if anybody has ever seen these green books. I've seen them. I have not picked them up to read them. The print is about yay big, but they have come out with a new 2021 green book. And the ministry has mandated that everybody with more than 20 employees must have a copy of this new book. Even if you have one of the old ones, you have to have the new 2021 green book in your office. You can order them online. They're $24.95. Amazon is sold out of them right now, but Amazon will have them as well. Okay. Next poll question. So, do you have up-to-date employment contracts in place for all of your employees? And I don't see that poll coming up. Oh, there we go. Okay. So do you have up-to-date employment contracts in place for all of your employees? Wow, this is awesome. It's looking like 3/4 of you do have them in place. That is amazing. Good, good. So it always seems really odd to have an employment contract in place right at the very beginning of somebody starting with you, and you're concerned about looking at different clauses such as termination and layoff right when somebody is joining you for the first time. But these are the most important factors of the employment contract, is to make sure that those termination clauses and the layoff clauses are very tight. There's been some recent legislation, and I think, Amy, you might be covering this a little bit later. Oh, here we are here. Okay, sorry. So one of the things that's important to know with employment contracts, ESA, which is the Employment Standards Act, versus common law. And a lot of people get confused in terms of what the difference is between these. So if you have a proper employment contract in place, it would refer to, in that termination clause, it would refer to, in the event of a termination, the employee would be entitled to minimum ESA entitlements, and nothing else, no more, no less than ESA entitlements. If you don't have specific verbiage around that in your contracts, then those employees would default to common law. So if you're looking at, for example, let's say we've got somebody with 5 years of experience with you. So let's use Amy as an example, 5 years with H2R. I'm going to terminate her, which I would never do, but terminate her under the ESA. I might owe her about 5 weeks or 6 weeks of termination pay. Versus common law, I might owe her 5 or 6 months worth of pay. So it is really, really important that those contracts are absolutely tight and refer to employment standards, entitlements only. So there was a recent case study, and if you have time and you're interested in this sort of stuff, Wakesdale versus his company, it was a termination clause in the current employment agreement that was up for debate. And what employment lawyers were hearing from right now is that basically any contracts that have been written in the last 10 or 15 years can pretty much go out the window because of this case has just changed legislation. So important to have those reviewed if you haven't had them reviewed in a while. And then of course, the layoff terminology. A lot of employment contracts that are out there right now do not have a provision or a clause for any layoffs. And we would really recommend that you do have that in there, especially right now during COVID. You may have to be in a position to actually lay somebody off. Okay. Mandatory work policies. So a lot of people say, there's so many different policies out there. How do I know what I absolutely need to do? So what we recommend is through OSHA, you have to have a health and safety policy, and that health and safety policy has to be provided to each of your employees, and it also has to be posted, physically posted in the workplace. And the same goes for workplace violence, harassment, and sexual harassment. Same thing. There has to be a full policy on it, and that policy does need to be posted within the workplace and communicated to all of your employees, as well as training. So other policies, if you don't currently have one, you do have to have a COVID-19 policy, as well as a workplace safety plan. And what we've been doing is combining the two of those and having them together in one document. The Ministry of Labor has been actively doing a blitz right now and checking workplaces if they do have these in place. At H2R, we can certainly help you with them, but it's cool because the government has actually put out a template that you can follow, and we'll go into what's sort of required in that workplace safety plan as well. But so those are the things in terms of policies. Must have health and safety, must have workplace violence, harassment, sexual harassment, must have the safety plan. Your AODA as well, you have to have a policy for AODA, and you also have to train on it. So there's lots of mandated policies and training that you have to have. Okay. So the training, what's mandatory for training? And this gets a little bit challenging right now because of COVID, but workplace violence, harassment, domestic violence, sexual harassment, bullying, and human rights, you must train on that. You must train on the AODA. You must train on WMIS and GHS, as well as the 4 steps to health and safety. So those are things that if the ministry were ever to come into your workplace and look at what you've done for training, they will be looking for these topics to have been covered by all employees. Okay. Amy, do you want to jump in here? I can turn things over to you for this one now. People are probably sick of hearing me talk, but I'll turn it over to you.
Absolutely.
Jill and Amy, we have a question. I'm not sure. Oh, if it was answered.
Oh yeah, go for it.
No, Amy did answer it.
I'm multitasking.
Perfect. Thank you.
Awesome. Thanks so much, Jill. So moving forward, I know this is a constant reality for everyone. Right now, our stats are just kind of out of control, definitely in the Waterloo region. So I pulled this information yesterday. It's the most up-to-date from yesterday, just on the dashboard. The most important part that I just kind of wanted to talk about is where you see the workplace, facility, and business setting outbreaks. This has been tracked by the region of Waterloo for quite some time now. Toronto is now just starting to put out this data. They were struggling in the past with people actually reporting incidents and being honest with them, but now they are asking that all workplaces report their outbreaks. So as you can see, this is what we do here in the region is it breaks it down by industry. And then this data right here is just showing us active outbreaks over the last 7 days. Again, I pulled this from yesterday, but it's something that we should definitely be paying attention to. With that being said, obviously under OSHA, which is the Occupational Health and Safety Act of Ontario, as an employer, you are legislated to do whatever is reasonable to protect the health and safety of your workers. So that being said, with regards to COVID, the data that has come out is somewhat alarming. So Jill and I were both focused on an article that came out in the Toronto Star the other day, which talks about the fact that more than 7,600 workers have contracted COVID-19 on the job. And from this, obviously, it's prompted thousands of workplace safety inspections across the province. However, it's interesting to note that the Ministry of Labor has only issued 2 fines, and one of them was to a worker. It's also, if you're following the news and, you're up to date on what's going on with these inspections, they have conducted over 31,000 field visits in which in the beginning they were coming out and it was more of an education check-in, right? Making sure that everyone had things in place in terms of policies, procedures, awareness. And it's interesting to note that they have issued about the same number of health and safety orders, which identified workplace violations and required employers to address them. So part of your job as the employer with regards to COVID-19 and creating that healthy and safe workplace for your employers is that awareness piece. So just making sure that with that awareness piece, you're providing that education. And the best way to do that is to post awareness educational posters around your facility. There are numerous ones that you can upload and get from public health. Even by Googling, you can get all of this information. Really important that you're creating that awareness piece within your workplace.
Yeah, and all the posters, you could just download them for free and just print them off. And if you've got people back at the office anyways. Yeah.
Thanks, Jill. Yeah. So this is an interesting topic that Jill and I have been exploring further. We don't want to get too much into it, but we thought we would bring this up. So should the COVID vaccine be mandatory by employers? So from the data that we pulled, 41% of Canadians questioned attempts to make the vaccine mandatory. 52% of those aged 25 to 34 see mandatory vaccination as a human rights violation, and 17% refuse vaccination outright. So these are some of the figures we were looking at. Interesting enough, though, I've included a quote. We did do some research and we've kind of had our finger on the pulse when it comes to this information, but a Toronto-based lawyer, his name is Stephen Wolpert, he was quoted as saying, however, employees can address the issue in another way, perhaps by stating that an employee cannot return to the office unless they've had the vaccine. So keep looking at this information, because I'm sure it's going to change wildly as as things progress in terms of the vaccine.
And I think some of the airlines already put something out to say that they will refuse anybody to travel here into Canada without having the vaccine, I think. And anyways, it's a bigger topic, and we partner with Nina from Gowlings, and we'll likely be doing some more sessions on this topic coming up later in January as things unfold.
Awesome. Thank you, Jill. So now we're just going to move into our third poll. So our question is, are you conducting daily COVID screening for employees or visitors? Okay.
This is good. Looking good. Yeah.
Yeah. Awesome. So just to note, for those of you who aren't, whether your rationale is because your office isn't opening or isn't open and no one's there, or you just haven't put it in place, as far as that screening process, it is mandatory. The government has mandated that all employers must conduct daily COVID screening for any employees and visitors who are entering the workplace, and also you must track that. There are 3 screening questions and one additional question that's recently been added in regards to asking people if they've traveled outside of Ontario. So up until this point, it's been outside of Canada. Now we're also asking if you have traveled outside of Ontario.
And if they have, they have to stay home and quarantine for the 14 days.
Yeah.
So it's not only the travel outside of Canada, but it's the travel outside of the province now too. And that's brand new as of last week.
Mm-hmm. Thanks, Jill. So this just gives you an idea of the questions. This is pulled right off of the government site. It basically asks you in the first question if you have any new or worsening symptoms based on the list below. They have you traveled outside of Canada? And then have you been in contact with a confirmed or probable case of COVID-19? And then additionally to that, you need to ask if they've traveled outside of Ontario in the past 14 days.
So there's a couple different ways that you could do this. Some of our clients and some employers out there are kicking it old school, and that's okay. They're using a pen and paper process to actually ask these questions and keep all of those forms documented. So that's one way of doing it, just the paper forms. Or if we go to the next slide, Amy, we talk about setting things up with a QR code and Google Forms. And I had no idea what a QR code was or a Google form until a couple of months ago. But if you have your device, if you have your phone handy, I'm just going to show you really quick what you would do. So this is the QR code here has been set up, the barcode looking thing for screening for our company H2R, but I just want to show you how it would work. So open up your camera, grab your device, open up your camera and hold like that up to the screen that you're seeing now, up to that barcode. It's automatically going to pop you into those questions. Have you answered those 3 questions? Have you traveled outside of Ontario? Do you have any of those symptoms, et cetera, et cetera? And then once you press submit, we'll go to the next slide, Amy. What will happen is that actually gets tracked in real time in an Excel spreadsheet for you. So it is so easy. We've been helping our clients set it up. It takes about 30 minutes to do it. It's really, really easy to do. And then you provide that QR code to each of your employees and or essential visitors that are coming into the workplace in advance. Or you can print it and have it posted outside the door of the workplace and perhaps at the reception desk if people are coming in. So in one way or another, you must have them complete the screening on a daily basis. And the ministry has been doing a blitz on this and issuing warnings and or orders or fines. The other financial support, I want to introduce the name Christine. Christine is Montag is the owner of Finance Without Borders. They are sort of a finance company like H2R, where they help small to medium-sized businesses with all things finance. So they have a payroll person, a CFO, a few accountants, and so they help smaller businesses with everything financial. If you have looked at some of the business financial supports, the CEWS, which is the wage subsidy, you'll be pleased to know that it's been extended until June of 2021, which is awesome. The rent subsidy as well extended, and the small business loan has increased. It used to be $40,000 and now they've increased it to 60. So those are things, and a lot of people don't do them because it's complicated and the numbers. And if you need help with it, contact Christine. Her email address is here on the screen. They can help you step through all of it, and their fees are absolutely reasonable. So I would have them help if you haven't done any of those calculations for your own business yet. Okay, so I think we have another poll question. Yes. So do you have a COVID policy / a workplace safety plan in place? Oh, results are looking good so far. So it looks like everybody is saying so far 100% yes. One person not sure what it is, and that's okay. This stuff is it's all brand new. Okay, so 94% say yes. 6% say they're not sure what this is. So the workplace safety plan, we'll step through what that has to look like next. All right, so the government has mandated that employers must have the workplace safety plan / a policy in place. You must communicate it to all of your employees, and it also must be posted within the workplace and have it accessible if anybody would ask you for it. It must cover answers to 6 key questions. And as I mentioned, the government has actually been great, and they put a template online that you can work through, and or we're happy to help to create that as well. So we'll just go through what the questions are. There's 6 key questions to this document. Okay, the first one, how will you ensure that all workers know how to keep themselves safe from exposure to COVID-19? So here you would list all of the things that you're doing to keep your employees healthy and safe when they're in the workplace. Okay. How will you screen for COVID-19? Again, you have to be doing the daily screening. So you would outline everything that you're doing with that and how it's happening. Question 3, how will you control the risk of transmission in your workplace? So have employees work from home if possible, maximize physical distancing and separation. You must wear masks within the workplace. Have hand sanitizer, look at your ventilation and airflow, and have good cleaning protocols. The 4th question, what will you do if there is a potential case of or suspected exposure to COVID-19 at your workplace? So again, what do you have to do, and what are those steps if somebody does have it? We've had, I think, 6 or 7 cases now with employees at our clients. Just had one again this morning, which is now considered an outbreak because it's the 2nd employee at that same company. So there's lots of things that you need to include in this, and this is really a key part of that. So what will you do? Okay, and then I think there's a second part to this with question 4. In general, close contact with someone who has been tested positive for COVID-19 must self-isolate for 14 days. We all know this already. But what's different that we've just learned in the last couple of weeks, even if you get a negative test, you still have to wait out those 14 days before you can return to the office. So even if you don't have any symptoms, you're feeling fine, but the test is coming back and the test is coming back negative, if you've tested positive first, you have to do those full 14 days. Does that, Amy, did I explain that right? I'm hoping that didn't confuse anybody, but yeah, even if you're getting a negative test, you've got to stay home. You also have to inform your employees, and you have to report it to the Ministry of Labor as well. And case by case, what we've been doing is contacting public health with every single case that we're coming up against, because I tell you, from week to week, it has changed slightly in terms of what the process is that they want us to follow. Okay. Question 5, how will you manage any new risks caused by changes to the way you operate your business? So that has to be included in that workplace safety plan. And the last question that we need to cover is, how will you make sure your plan is working? So what are you going to do to make sure that what you're doing is effective? And as the employer, you are keeping your employees safe and healthy. Okay. So Amy, I think I'm turning it back over to you. Yes.
Awesome. Thanks so much, Jill. All right. So I'm not sure if people are aware of the class order that was put in place by the region of Waterloo. This went into effect on October 6th at 10 a.m. And this class order essentially provided further direction with regards to 3 scenarios. So if you are a confirmed COVID case, if you have signs and symptoms or being tested or awaiting results, or if you've had close contact to someone who is a confirmed case of COVID. What the class order does is it outlines the amount of time that an individual is required to self-isolate or to quarantine. The important thing to note about this is when someone has come into close contact, and I know Jill kind of mentioned this in their previous slide, if someone comes into close contact and they are required to get a COVID test, even if their COVID test comes back as negative, they are required to self-isolate for that 14-day period. So important to note that a failure to comply, there is a fine that can be issued for every day or part of each day on which the offense occurs. Second to that, on Monday, December 14th, the region of Waterloo also put in some further regulations. This information specifically speaks to COVID-19 screening measures, having a safety plan in place. It talks about physical distancing and face coverings or PPE. And then it also goes on to talk further about ventilation and HVAC systems. This is something that's newer outside of the region, but it is encouraging employers to take a closer look at their ventilation and HVAC systems with regards to the quality of airflow. Important to note that failure to comply with these regulations, there is up to, and I read this correctly, the possibility of a $10 million fine for each day or part of each day on which the offense occurs or continues. Now, to ease your mind a little bit, we did a previous webinar where we did have Nina Gupta on from Gallings, and she said that she's never seen such an amount in terms of a fine, so not to scare you, but it is important that you do understand what the regulation states, and as an employer, what you should be doing to keep your employees healthy and safe. So again, I just thought I'd take a quick second to review the 3 new benefits that were introduced by the government. These were announced at the end of August, and then they came into effect on September 27th, and they are in place for up to 1 year. So these 3 benefits include the Canada Recovery Benefit, or the CRB, the Canada Recovery Sickness Benefit, or CRSB, or the Canada Recovery Caregiving Benefit, which is the CRCB. And I have to say, we really do like these acronyms ever since the government has been introducing these programs. So it is difficult to just go by the acronyms. It's important that you understand what they actually mean. So the Canada Recovery Benefit. This is a benefit that provides income support to employed and self-employed individuals who are directly affected by COVID-19 and are not entitled to employment insurance benefits. And this benefit is $1,000 for a 2-week period. The second benefit is the Canada Recovery Sickness Benefit, or the CRSB. This provides income support to employed and self-employed individuals who are unable to work because they're sick or need to self-isolate due to COVID-19 or have an underlying health condition that puts them at greater risk of getting COVID-19. This is a $500 amount for a 1-week period. It's really important to note that the government just made some changes that were announced yesterday. So any individual that has traveled outside of the country or has gone, by airplane, left Canada and come back, they put in a stop because people were taking advantage of this. People were coming home and being forced to quarantine for that 2-week period. And the government has now said that anyone who travels outside of the country for non-essential travel and comes back is not eligible for this benefit. The last benefit is the Canada Recovery Caregiving Benefit, or the CRCB. So this is income support to employed and self-employed individuals who are unable to work because they must care for their child under 12 years old or a family member who needs supervised care. This applies if their school, regular program, or facility is closed or unavailable to them due to COVID-19, or because they are sick, self-isolating, or at risk of serious health complications due to COVID-19. This is a $500 amount for each 1-week period. And it's important to note the reason if an employee says, I can't come to work, I'm applying for this benefit because I need to stay home and watch my children. If their children's educational facility is opened, they don't qualify for this. This is only if the schools were to shut down permanently or the daycare facilities and they didn't have access to them because of COVID. So Jill, I think I'm going to turn it back to you with some information with regards to the different color levels that we currently have in place.
Yeah, sure. Thanks, Amy. So we're not going to go through all these in detail. I'm sure that everyone has probably seen this visual before that's looking at the differences between each of the different color stages that we could be in. The point that we wanted to just make on here is that each of the items are continuous. So what you have to do in red has to be everything that you had to do in orange, yellow, green as well, all of them combined. And obviously right now we are in the lockdown stage. Okay. Province-wide shutdown. So the current COVID-19 response framework is paused while the province-wide shutdown is in effect. So this is in effect, as you know, from Saturday, January 9th, 2021 to Saturday, January 23rd, 2021. So no indoor organized public events and social gatherings except with members of the same household, weddings, funerals, other religious ceremonies, a maximum of 10 people, et cetera, et cetera. And you've seen some of those restrictions. And there's also a link there if you want to read more on that. Okay. Next poll question. Okay. For your employees working remotely, are you doing regular check-ins with them? So are you checking in on a daily, weekly? Are you doing that regularly? Looking good. So most are, which is great. So it looks like 80% are. And, some of the things we're hearing from leaders that we're dealing with is, they don't always know what to say. So they're not saying anything. They want to know that that person is doing okay. But at the same time, they're not sure, if that person starts talking about, anxiety or mental health issues, they're not sure what to do with it. So we're hearing a lot of that. Initially when COVID first hit in March, I think a lot of people that were working from home were like, woohoo, it's, working our pajamas all day and it's going to be fun. But the novelty has worn off for a lot of people. And there are a lot of employees that are really, really struggling with working from home. The isolation, a lot are feeling depressed. A lot of people are feeling that they've got no energy. They're really missing that, that socialization, especially those that are true extroverts, are really suffering with this. So just take time to ask people, you know, how are you doing? And really care about what the answer is to that. I mean, it's just, there's a lot of things going on. We at H2R, we've had to deal with 3 different potential suicide situations since COVID has hit. We've never had to deal with things like that. And we're certainly not the experts or suicide, you know, prevention experts or anything like that, but it's new things that are coming up because people are just not themselves. So do make sure that you check in with your employees.
Thanks, Jill. So just to highlight a little bit more information with regards to mental health. So important to understand what mental health is. Mental health is a state of being. It's about feeling good about who we are, having balance in our lives, in our thinking, and managing life's ups and downs. It's about how we feel about ourselves and other people, and it's a key part to our overall health. So why is that important when you're considering mental health in the workplace? So where the workplace often gives people a purpose, a sense of identity, belonging, social contact, and security. So it's really important as an employer or supervisor, manager, to find new ways to work and interact while also taking care of our mental health and well-being and others' mental health and well-being. So just some quick tips. As Jill mentioned, you know, none of us are experts in regards to mental health, but there are things, really easy things that you can do to help support good mental health. So encourage and facilitate regular communication with employees. Recognize the impact of isolation and loneliness. Show empathy and be available. Even if, you know, we're not the experts and we don't claim to know everything, it goes a long way to show some empathy when someone is struggling. And then also take advantage of the resources that you have in place. If you do have an EAP or a health plan, there's also lots of free resources out there that you can promote and send out to employees. So again, these are just some things that you can do to support that. Okay, so that brings us to question and answer. I have been trying to keep up with questions as we've been going through. So I think if you want to come off and ask a question, I'm not sure what the best way is. Maybe to raise your hand.
I think they have to put it through chat. Yeah, it has to go through chat, Amy. So there's been a couple in here. One person was asking, I don't see this revised screening tool with the Ontario question anywhere on the Ontario government website. It's still showing the old screening tool. So that question just became legislated, I think on, was it Friday, Amy? I'm losing track of my days, but very, very recent.
Yeah.
They likely just have not updated that tool yet, but rather than it saying, have you traveled outside of Canada within the 14 days, it now has to say, have you traveled outside of Ontario? Karen is asking, can you give examples of how you can check if your workplace safety plan is working? Absolutely, I would check in with your employees. Are they feeling safe? Do a quick poll with them. Have you missed anything as the employer? Do you have all the right hand sanitizing, people wearing masks? So double check based on what you're putting out there if that is if that is what you need. This is what is known as the fourth wave of the pandemic, says Tim. I don't think that was a question in there. And then the next one is, are all of these training programs required to be reviewed annually? Good question. Most of them, no. The government is recommending, so for example, violence and harassment in the workplace, they recommend that you retrain on it on an annual basis, but it is not mandatory. I would recommend that you do that one on an annual basis, but again, it's like I said, it's not mandatory. Okay, so Trish is asking a question. Self-isolation for 14 days now has to happen when you travel outside of Ontario. Yes. Yeah, it does. I am having a hard time with the accessibility compliance report online. Any tips? I'm sure, Karen, you could connect with us after, and we can certainly walk you through that if you'd like, and help with that. And it's been extended until June, the deadline. Any other questions from anybody? Don't be shy. Feel free to put your question in there, and I'm sure if you've got the question, somebody else is probably thinking it too. No, maybe not. Okay. Oh, we've got another question here. If we have seasonal employees, should would we retrain annually if they are returning employees? No, you don't have to, but it would be a best practice to do the training on an annual basis, but you certainly don't have to. When lockdown is over, let's hope for that. Yes, please, please, please. Do you have to bring staff back based on seniority? That's a really good question. So right now, if you have anybody off, they have deemed that anybody off on an old layoff is actually deemed to be off on what's called the IDEL, Infectious Disease Emergency Leave. And that's what is actually in place to protect employers right now. So it's extending the time. So if you have anybody off, they go on IDEL. IDEL has just been extended and will expire July 3rd. So you have time. If you still can't bring somebody back after July 3rd, then you could put them on a true layoff for those 13 weeks or 35 weeks if you're continuing their benefits. But yes, those folks would be off on IDEL right now if you're putting them off. Paul from Orchard Designs email address. Yes, Amy, could you put that into the chat? A couple of other questions. For those that may have received the vaccination, do they need to quarantine when they return to Ontario or Canada? That is a good question. I don't know. I don't know. What have you heard anything on that side, Amy?
No, that's still way too new.
Yeah, I have not heard anything. Can I get a copy of the presentation? Sure, we could definitely send that to Melissa, the copy of the presentation, and Melissa could circulate it. Caroline is asking, what differences are you seeing between provincial and federal HR rules and regulations, and are there any? Definitely differences. We have only a few of our clients are federally legislated, but they sort of follow both. Whichever is sort of the greater benefit to the employee, they're doing both, whether it's federally legislated or provincial. If one provides the greater benefit to the employee, that's what most of them are going to do, and there are differences between them, yes. If they are on the emergency leave, what code should we use on the ROE? Good question. So if somebody is on that IDEL, the infectious disease emergency leave, you would either deem them to be on that because of shortage of work, or if they are ill. So it might be shortage of work code, or it might be a sick, unpaid sick leave code that you put. What about a courier drivers dropping off a package? Do they need to be asked the screening questions? They are essential visitors to the workplace, so yes, they should be. And that's again where that link would be really handy to have versus having them fill in paper and pen every time they come. If somebody has been laid off due to seasonal employment more than 13 weeks, is there anything new with COVID regulations that an employer should know if we don't want to bring them back or offer them a new contract? Yeah, if you know that you don't want to bring them back, that is, some people are calling it's a permanent layoff. Well, a permanent layoff is a termination. So if you know that you do not want this person back in your workplace, then I would just rip that Band-Aid off and do the termination. But you can have them off on IDEL, which will expire in July. At that point, you could then put them on a layoff, but you're just delaying the inevitable, right? Ugh, I can't ever say that word. Anyways, you're just delaying it. So if you know you're not going to bring them back, you might as well do the termination. Any other questions? Those were some good questions. Thank you for for asking those. Those were really good. So I don't think there's anything else. Melissa, is there anything else that you want to cover before we wrap things up?
I am just going to put our YouTube screen up so everyone can just take a look at where the video will be posted later on today or tomorrow. So if you just want to write down that information, I'll also send it in the email that I send out with the presentation for everyone.